Okay, this is a set of nasal bone reduction forceps. This is the Walsham forceps and this is the Ashes forceps. The commonest confusion occurs between these two forceps, so I'll show them one at a time. This is a Walsham forceps and it usually comes in a pair, one for the right and one for the left side of the lateral nasal wall. The Walsham forceps has a tubing that covers the outer surface which goes towards the skin side for protecting the skin from damage, and it has an inner flatter side which goes for the mucosa. So this forceps will be used for the patient's left side. I'll demonstrate it on a skull. So it has to be done from the foot end of the patient. You are facing the patient and you have to stabilize the nasal bone with the index and the thumb of the left hand if you're a right-handed surgeon. You have to hold the lateral nasal wall with this forceps. So this is for the left side of the patient, and you have to stabilize it and turn it towards the outside. Similarly, this one is used for the left side and there will be another forceps for the right side. So when you use it for the right side, it will turn and go like this and you have to rotate it outside. The first step is always using the Walsham forceps. Once you have done the lateral nasal wall reduction, then comes in the role of the Ashes septal elevation forceps. Now the Ashes septal elevation forceps has a unique feature that there is a gap in between the two blades. Even when you close it, this gap always should be present because it avoids damage to the mucoperichondrium of the nasal septum. As you can see, there is a distinct angle in the forceps, and that is used to go along the nasal floor for bringing out the septum. So when you are reducing it, again you are facing the patient at the head end from the foot end, and you have to insert the forceps in this manner. It goes in and you have to hold the septum and you have to iron it out in this manner. So it goes down along the nasal floor and you have to pull it up and iron it out. So after reducing the lateral nasal wall, then comes the ironing out of the septum as the last step. So these two are the forceps, the Walsham that comes in pair and it closes completely on approximation, whereas the Ashes septal forceps, which is angulated and it never closes completely on approximation to avoid damage to the mucosa.